Good morning and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetselaar, Editor-in-Chief of the journal. This particular podcast is focusing on the article Health-Related Stigma and Challenges Faced by Men Living with Celiac Disease, a qualitative analysis. And with me today, I have Rose-Marie Satherley from the University of Surrey, Department of Psychological Interventions in England. Dr. Satherley is a lecturer in the clinical psychology program where she trains future clinical psychologists. And her work, very importantly, explores the intersection between diet-controlled conditions and psychosocial well-being. This work includes leading studies on anxiety and food concerns in celiac disease, as well as developing psychological interventions to enhance well-being alongside dietary management in both type 1 diabetes and celiac disease. And her most recent work has focused on the stigma faced by men living with celiac disease. Thank you so much for being with us, Dr. Satherley.
Thanks for inviting me.
I will begin with a few questions related to your work in this area. I've just indicated that your article is focused on a qualitative study design and wondered if you would describe a bit for us that research design and then why it was chosen for this particular topic on celiac disease in men.
Yeah, so I guess broadly we can think of research as both qualitative or quantitative, or mixed methods even. So for this research, a qualitative design was chosen because it allows for a really deep exploration of individuals' experiences, emotions, and the social contexts that shape their perceptions of stigma. So this allows us to go beyond statistical trends in the literature and start to develop new theories or new hypotheses from small groups of people that can then be used later to inform larger analyses. So this was particularly important in this study because actually for men with celiac disease, their voices are really underrepresented in the literature. If we look at the quantitative studies, and I can't quite remember the numbers off the top of my head, but it's usually sort of sub 20% of the sample are from those identifying as male. So actually their voices aren't out there, but we know men do have celiac disease. So I really wanted to spotlight their voice in this research and invite them to bring their perspectives forward and shed new lights on what we already know about celiac disease.
So, central to your research is that very timely topic of stigma. And what are some of the types of stigma that were identified by your study participants?
Yeah, so importantly, this study looks at specifically health-related stigma. So that's about the negative attitudes and beliefs that others direct towards people with celiac disease, either because of their celiac disease or the need to follow a gluten-free diet. So we spoke to men and asked them about this. Now, really interestingly, I used the term stigma in our research adverts, and I used the term stigma in the interview protocol. And none of the men in this study actually identified with that term. When asked if they felt stigmatized, they would often say no. But then you listen to their experiences, and actually you can apply a stigma lens to that. So a lot of the things people were talking about were, for example, ordering food in a restaurant and having eyes rolled at them, or, oh no, we don't do that sort of thing for men like you. And those are microaggressions, those are stigmatizing behaviors that had a real emotional toll on the participants. There were also examples in healthcare settings. I think in the paper there's an example of a man who went to go and get an endoscopy, and actually the person said, you don't need any pain relief for this. You're a man. You can do this without that. And that's completely inappropriate. And that's where you can see sort of this interaction between masculinities, ill health and celiac disease, and stigma.
Thank you. So interesting. What were some of the results of your study? What did your study show?
I think the interesting thing about this is actually it's not all that surprising. I think if you work with people with celiac disease, and certainly if you live with celiac disease, you would not be surprised by these results. So the men told us that actually celiac disease was socially isolating. And we know this from the broader literature. And they felt isolated, and that isolation was imposed by others, but also brought upon themselves. They chose not to go to social events because it felt easier to do that sometimes. But what was really interesting about this is men used really sort of vivid metaphors to describe this isolation. So people spoke about feeling like an alien or someone from Mars. And what's incredible here is that a condition that I think a lot of us think of as invisible and might think actually there's not a huge impact of celiac disease. Actually, this invisible condition in food settings became visible and really impacted people. The other thing we found, we documented lots of microaggressions that these men faced and how this had a psychological influence on them. So, as I just discussed, things like eye rolling and we don't serve gluten-free food to people like you, that was documented a lot. But what was interesting here is not only do men face those aggressions, they start to internalize them and believe them about themselves. So they internalize this stigma, and you see men saying things like, "Oh, I am a bit of a moaning Minnie," or "Oh, I am very difficult." So actually, they begin to believe these things about themselves, and we know from psychological models that that actually starts to affect well-being and quality of life and lead to things like shame and isolation. And the other thing that we found that there was a real interaction between what we might consider masculine norms in society that influence men's health behaviors. So I think often men are viewed as manly and strong, and they can't be weak and vulnerable. And that meant that really affected interactions in healthcare, like I previously discussed. So people saying, you need to be strong, you can't have pain relief to do this. And I think actually that masculinity aspect, we don't think of day to day in healthcare. Certainly this brought my attention to it speaking to these men. And it really raises the question of more sort of gender-informed healthcare and how we can encourage men to follow the gluten-free diet to manage their celiac disease in a way that fits with their identity.
Such important concepts. And I think the fact that you chose a male population really speaks to ways in which we probably need to start looking at stigma, because there can be major variation in the way a female population, for example, might look at a disease like this versus a male population. Just incredibly important results from your study. And then finally, our academy includes registered dietitian nutritionists, and I wonder what your advice might be to them in terms of how they might use what you've learned in working with their clients or their patients.
Yes, I think the key thing for me from this study and a growing number of studies in this area is for men with celiac disease, the gluten-free diet isn't simple. It's not simple for anyone with celiac disease. And I think often we forget that in clinical practice. So it's about asking, well, yes, of course, how is your gluten-free diet and your management, but how are you facing this? How is this being integrated into your daily life? Are you facing any struggles? And of course, asking these questions gives you a real insight into adherence and whether people are following the gluten-free diet well. I think what this study shows as well is an importance of the adherence to the gluten-free diet without compromising perceived masculinity, and the role of healthcare providers to support in sort of compassion-based language to combat those feelings of shame and self-depreciation we see in this study.
Mm-hmm.
And to support gluten-free diet management that resonates with men's lifestyles and preferences. Now, there's a huge gap here. I think all of us in clinical practice, the obvious question is, how do we do this? How? And actually, we don't know. Most interventions, whether they be dietetic, nutrition, or psychological, are developed with women with celiac disease and females with celiac disease. There is no voice for men. So I really call for the research going forward to co-design interventions alongside men with celiac disease so we can develop gender-sensitive approaches.
Thank you so much. That is incredibly helpful. I work in studies where we're using gluten-free diets, and we need to focus more maybe on differences in gender and how that might affect certainly adherence as well in terms of our studies. Thank you so very much for these additional ideas related to what registered dietitians might do in clinical settings, but also just for your work on this incredibly important topic. I think the idea of stigma is something that we're starting to deal with more and more, and it certainly should affect everything we're doing in terms of working with our clients. So thank you for your work in that area. And thank you for responding to my questions today. And I so appreciate your time that you've devoted to the podcast. Thank you.
No problem. Thank you so much.